You just get like this wave of like, oh my God, we are solving an issue here and it's going to help people. He understands it. He didn't know we were building the app.
Around, well, if the technical barrier is so low, what is going to be the differentiator?
In the old days, it was how do you build an app that's better than Excel? Nowadays, a lot of it with social networking is what does Reddit and Facebook do and what can you do that's better than that?
And also the doctor, can you imagine if I'm the doctor at the moment where coming in, my patient actually give me all this information about this like patient instead of me going through trying to piece every single information together. How good this is.
I'm sure you've probably also seen like a lot of the stuff on TikTok and Instagram around like people generating PRDs. I don't know. I've not worked really in a team or organization that uses a PRD. I think the way products are actually built is completely different.
Welcome back to the Product House. So I'm Charlotte.
And I'm Kiet.
So happy 2026. Actually, we have something really exciting news to share to kick off the years. The role of the product managers has been evolving a lot. And really, because of the AI, a lot of the people are letting us know they feel like their career are really shifting. So we actually decide to shift together with these new trends as well.
Over the past year, Product Pals has been a space for human conversations about the product journey. Lately, we've noticed a shift going from ownership of products to ownership of outcomes. Many of you have made the choice to go deep into being an AI PM. Some have finally decided to start your own ventures, and others have decided to take up more senior positions outside of product altogether.
So we know these transitions are both exciting and scary at the same time. So because we are going through them ourselves as well. So we decide to grow the whole podcast together with you. So this year, we're actually evolving our Spotlight series into something a bit new. So it is for those bold enough to step into new roles, explore new identities, and redefine success on their own terms. So whether you are a founder, a senior product leader, small business owner, or a creator in any form, we really hope you will find yourself in the series, what we call Beyond the Build.
And to kick things off, we've got an inspiring story today from product managers and designers to founders. Today's guests, Ines Goluza and James Riddell, share their journey behind the Myhre Syndrome Foundation Australia and the Rare Journey AI app. It's a conversation about purpose, partnership, and what it really takes to build something bigger than a product.
I love this story, so let's dive in.
Welcome, guys. A bit of background for our viewers. Ines Goluza is the co-founder of Myhre Syndrome Foundation Australia. She began her career in law before quickly pivoting into product management at Services New South Wales. She jumped into product consulting with one of the Big Four consulting firms, and in her latest role, she's focused on strategy and growth through AI products. James Riddell is currently design lead at ServiceGen, the startup founded by the Honourable Victor Dominello after he left office as Minister of Customer Service. ServiceGen focuses on helping government with digital service delivery. And prior to that, James was part of the team that launched the Services New South Wales mobile app and the New South Wales Digital Driver's License Program, which is a huge deal if you live in New South Wales as well. So please join me to welcome Ines and James. Quick icebreaker for the audience to get to know you a little bit better. We find that most founders tend to be builders as well, right? We would love to know, what was the first thing you ever remember building as a kid?
So thanks, Kiet, and it's great to be here. I think for me, it's always been interesting to play around with what's possible. I remember my first job during my university years, I was in a data entry job, and I went hard in on listening to the How I Built This podcast, which is stories about founders and how they built these incredible products. And I think that's where my curiosity was really fueled. So I played around with HTML in the early MySpace days and how you can make your MySpace pop. So I would say that was my first kind of avenue in.
Wow.
I think everyone's kind of gone through that journey thinking about, what background's gonna make it pop. But from there, we built a few products and brought them onto the market. So the first one was the Wellbeing Edit, which was a physical product. It was kind of after COVID, where everybody started to rethink what their wellness looked like. So what we wanted to do is build a really high functioning yoga mat that felt beautiful and it felt like an investment in terms of looking after yourself. Shortly after that, we pivoted into the tech side of things. So how might we be able to unlock all of the creators that were coming out from the wellbeing space and connect them into new communities?
Wow.
We've also, spent a little bit of time tinkering on the weekends around setting ourselves challenges on what we can bring and how quickly we can build something. So I think it was over an Easter weekend, James and I set ourselves a challenge on whether we could develop a product in 24 hours. And that resulted in an application called Run Club Run, which is a space where you can find a run club near you that feels like you can start your running journey, or find a community that, helps you run in a safe space.
Nice.
That's amazing. Is the app still exist? Is the Run Club and all the yoga one still exist at the moment?
They still exist. They're not as nurtured as much these days because our focus has shifted a little bit.
Yeah, because I would love to sign up because both of them sounds great. And especially for the physical, like yoga mat with physical device and everything, that must be really hard as a side hustle almost.
It was definitely a learning process to go from software into physical products. Again, just another, new avenue in terms of what you learn when you want to build something.
Yeah.
Wow. Well, if you wanted to promote that as well, feel free to send us a link for both of the two products. We can include it in the show note for people to try out as well.
Ines, we've known each other for a little bit now, and during COVID, when you showed me the yoga mats, I was like, wow. It always blew my mind how you would actually find time amongst everything else to do everything you do. So it's always been very impressive. And James, did you have a history of tinkering and building?
Yeah, definitely this sort of experimentation mindset. Like the very first thing I built was a surfing app, surfing tutorial app. Mind you, I grew up in Tamworth, which is like 6 hours inland. I cannot surf, but I just built this Flash 5, if you remember, like your animation software.
Yeah, I do. We're using all this bouncing ball with the Flash. Yes.
Oh yeah, so it was like a clickable prototype, like a Figma prototype, but back, I don't know, this is probably 20 something years ago. And then through uni into like early working days, just had this like knack for side hustles. I definitely got caught up in the e-commerce and drop shipping cycle. We built this dinosaur toy drop shipping site called Dino Store. It didn't really take off, but it was like just that learning. How do you do this? How do you set up the Shopify, set up the marketing, set up the supplier, get it all automated? Yeah, a bit of a fun experience. I've got two boys, and I'll talk about one, but the oldest, who's 5 now, really love bright, colorful t-shirts. And the market for that, for like young boys t-shirts, is very much like dinosaurs or trucks. So we built this print on demand site for bright children's clothing. Like
Wow.
all of these ideas, I try to convince my wife to buy a coffee cart, a coffee caravan for our local beach. Really thought that was going to take off. One we did last Christmas Eve. I was like, what am I going to do for my wife, Ivana? So I decided to build this like platform with ChatGPT, giving me the idea. It's like a love coupons. So you might sort of remember the idea. You get a coupon. It's like good for one hug, or here this massage, or a romantic dinner.
Yes.
There's that. You get like a physical product, and I thought, oh, surely I can build like a digital version of this. So Christmas Eve for like 2 hours, I was tinkering with V0 and these different AI tools, build out this little platform for digital love coupons, and we've launched it. It's a real product called Couples Coupons. We've made sales, but it's like these little ideas that we just work on the side, and I think it's like that experimentation and that sort of self-education I really, really love.
1 or 2 years ago, Patrick, which is my husband, give me some of these love coupons and they box now. I'm going to find who's a provider for that, because I think it's also one of the local makers of that as well. It could actually be yours, James. So I will actually go back and have a look at.
I'm loving the theme around founders as family person as well, right? Because oftentimes your key stakeholder is your partner and how responsive they are to your quote unquote hobbies on the side is something I'd love to pick your brain on as well.
Yeah. Well, you can also do one of these weekend hackathon, like what Ines and Jem do. That's really inspiring. Like 48 hours, what we can build. So cool. I wonder if James and Ines wanted to tell us a little bit more about the Myhre Syndrome Foundation Australia and also a little bit about the Real Journey AI.
Yeah, so I'll probably go on the Rare Journey side to start with. We call it an AI companion app to help with management of rare diseases. To rewind a little bit, in July last year, 2024, my wife and I, we brought our second boy into the world, which was very exciting. That excitement was sort of met with a bit of heartbreak pretty soon on. His name is Felix, and Felix was diagnosed with a ultra rare genetic disorder, and that's called Myhre syndrome. It's ultra rare. There's only around 200 cases in the world. There's 12 in Australia, and it's a connective tissue disorder. And what that means, connective tissue makes up everything throughout the body, all of your skin, your cells, your organs, and then that means you can have a very broad range of symptoms. They can be physical attributes like small stature and things. There's cognitive, developmental delays, autism. One big defining attribute is this process called fibrosis, which is basically the hardening of tissue. It can be skin, can be muscles, can be organs as well. And that process is potentially very life-limiting, very dangerous. So Felix also has of course he does, he's pretty complicated, loves attention. He gets a lot of hype from when we play with him, but he also has a complex heart condition as well called tetralogy fallow, and that's a group of multiple heart defects that was immediately life-threatening. He's undergone, so he's a bit over one now. In that first 12 months, he spent about 150 days in hospital, multiple heart procedures. He's done it tough, very, very tough, but he's doing much better. He's stable, he's growing, he's healthy. He's still complicated and has like a lot of complex needs, and he will need that for his life. For us, like obviously it's devastating navigating. It was emotionally very hard. You have the grief, you've got sort of the unknown, you've got this uncertainty. And I guess all the while you're stuck in this dark hospital ward. So yeah, it's been a tough journey for us. We would reflect on experiences where doctors would come in groups of 10 to discuss Felix, and you're already in this vulnerable sort of position.
Yeah.
You don't feel very prepared. You're sort of taking in a lot of information in one go. It's new. It's very confronting information. And we were just finding it very hard to manage all of the things that were going on.
Yeah.
With a rare condition, what made that even worse was just the access to information as well. There is very limited, like published information, peer-to-peer medical reviewed information. What we did find was that there is a great source of community information. So access to a private Facebook group, go in and find some really validating and relevant information, but that's very manual. And through these posts and threads, which are multiple years old and they're very like 50 comments deep, it's also not like the easiest way to access that information.
Yeah.
Yeah, so we started to sort of get deeper into this problem. We started to reach out and speak with other community members, and we were picking up on this theme that like this, while it's devastating, it's not unique, and while rare diseases are rare, that these experiences and challenges aren't unique as well. They're very common. So that sort of thinking started to get us into forming this idea. And I know that I'm going to give a bit of a demo of the app shortly.
Yeah. Love to see that.
Yeah, so that's sort of where this all originated, basically out of a point of need for the app.
Yeah. Can I ask a follow-up question before we go into the foundation itself? I guess because it's such a real disease, what's the diagnosis process actually like? Is that the doctor here managing to diagnose it correctly in the first go, or they went through a few of back and forth?
Yeah, it's genetic panel testing. So they don't do this during the pregnancy type of testing. During
Yeah.
pregnancies, they test for like major diseases or major syndromes, but they don't do this type of testing. We started to very shortly after his birth. He had oxygen desaturation levels. He came out very small. He was actually premature by a few weeks. Uh, and so with the heart defect, the small sort of size and the lack of growth, there was also a couple of like minor defects. We'll call it defects. It was very medical, but the doctors thought the bridge of his nose was quite wide. It looked cute, beautiful to us, but they start to like piece it together. There's multiple things here. Let's go and inspect and have a deeper look. So basically that was the process. And then they do further genetic testing from that.
Charlotte, though, you do touch on a very important point, though. So, in the case of Felix, diagnosis happened almost unexpectedly quickly.
Mm.
In rare disease, there is this concept around the diagnostic odyssey. And that concept is all around this 5 to 7 year delay that people experience just to get a diagnosis. And so, whilst Felix was diagnosed very early, what we do know in the rare disease space is that that can span years. And as you can imagine, moving through those years of uncertainty um, is really complex to navigate as well.
Yeah, yeah. Wow. Oh my God. This story is really heartbreaking, to be honest. Like when I just hearing it, I can just imagine that the emotions from both the family, the parents, and also the I guess kids probably, for Felix's perspective, he's probably too young, but he probably want a lot of cuddle. He doesn't want to stay in the hospital, want to spend it with family. How difficult that it is. And at the same time, I also find that it's actually really kind of I guess inspiring to hear that in the middle of everything happening, and James and yourself and Ines and the mother as well, thinking about taking actions, have a space thinking about how do we actually solve the problems almost systematically for other people. So that's truly inspiring there. So Ines, do you want to share a little bit about the foundations as well? Because I know that's actually, and also it might be interesting to know, did you come up with foundation idea first before you come up with the app, or is one verse of the other?
It's a really good question. As part of our journey, what we did is we connected with the existing communities that exist. And because Myhre syndrome is ultra rare, which is the technical term because of the numbers of people that it affects, we connected in with the global Myhre Syndrome Foundation, and we were able to get some resources there. And then, as James mentioned, as well as that community Facebook group. I think for us, the reason for starting the Myhre here in Australia is because we know that in order to create change and to be able to create that change at speed, we really need to be thinking about how we can really accelerate those pathways and better outcomes for people living with Myhre syndrome Australia. We also know that because of this ultra rare side of the conditions, we need to do things differently. And that's really where the origins for the Myhre Syndrome Foundation Australia began. So for us, this means being truly human-centered and understanding the unmet needs of our community, then really leaning into how do we mobilize research and clinical insights for earlier diagnosis, to your point, Charlotte, but then also treatment, care, and management pathways throughout life's journeys. For us as well, we're working and we have the ability to leverage AI in our time and day. And this is really exciting for the broader general healthcare community, but particularly it has an incredible potential to create an impact on
Mm.
which have typically been underserved because the problem space is so complex. So for us, we really see AI as an enabler to be able to meet the unmet needs of our community. So we're really thinking about, how can we create better healthcare pathways or help people navigate their rare disease journey? How do we use AI to accelerate the research translation pipeline, which can take years? How we also operate ourselves. So we've termed this the foundation of the future. So how do we really be AI native as a foundation from the start as a non-for-profit? So what we want to do is kind of operate like a technology startup that's super lean, agile, but also really relentlessly focused on testing bold ideas at scale.
Wow. So because you guys are actually the time frame for running these is pretty quickly together as well. Because I think James mentions Felix was born July last year, and then now it's November. So this is literally less than 18 months time, and they'll have a foundation set up and they have app set up. So what's the kind of a rough timeline for you guys look like?
Yeah, I think it was around, it was our admission during February at the start of this year where it started. This was probably our, I don't know, hospital admission in as many months almost. And it was a long one. It was when he was going in for his heart repair surgery. And that ended up being around 3 months. So it was during that admission where we started to get a lot of thinking time, but also start to unpack like a lot of these problems and challenges that we were facing.
Yeah.
So during that time, I was trying to balance work, trying to balance my 5-year-old as well. We were admitted at Westmead. We actually we had access to the Ronald McDonald House, which was a complete lifesaver. Like shout out to those guys, they do amazing work.
Yeah.
Know how we would have really coped without having that support and that access there. But yeah, it was probably from the start of February where we really started to view these challenges
Yeah.
and formulate an idea based on that. And yeah, as Ines sort of mentioned, the use of AI tools really rapidly expedites anything you can do nowadays.
Yeah.
But we went so pretty much maybe February, March from like where we really wanted to start this.
Mm.
And we've had pilot users since probably the start of October now. So around 6 months,
Uh-huh.
I guess you could say 5 to 6 months.
It's a very quick speed to market.
Thank you for sharing Felix's story. As a parent, I could imagine that it's such a motivating moment
Mm.
and motivating experience in kind of trying to solve for the problems of guiding children through such a life-changing experience. Just curious to kind of understand, if I put a kind of product management hat on, in the old days it was, how do you build an app that's better than Excel? Nowadays, a lot of it with social networking is, your base bar is, what does Reddit and Facebook do and what can you do that's better than that, right? I'm curious to understand what is the idea that sparked the creation of the Rare Journey app and what are you trying to solve for with the app itself?
Yeah, good question. I guess that the thing that really sparked us to do it was self-need. Selfishly, it was self-need. We were seeing that there was a gap here, and there were gaps in some of the things I mentioned. So, like, how do we track all of these things with this complex syndrome? He has GI, gastro issues. He has his heart condition. He has respiratory issues as well. This fibrosis process, the hardening of tissue can affect his skin. It affects wounds when he's getting injections, needles, things like that. So there's this broad list of systems that we were trying to, systems and symptoms we were trying to track. There's also then like the education of clinicians. Our doctors had never heard of this syndrome. The geneticist who called us to diagnose us had only heard of it once. And we went to our pediatrician, which is like your core support person. He opened up a book and it's not in the book. And he's like, I don't know, I'm going to have to Google it. So like we were educating, and we still do this. We educate clinicians on almost every single consultation. We were thinking like, there's got to be a better way to do all of this than write notes on a piece of paper, or yes, you could potentially solve it through like several different Google apps, but like that's not really going to help reduce the administration burden.
Yeah.
One key thing, and it's like the heart and soul, I think, of where we want the app to go, and it's around this community insights. So LLMs, they're trained on the whole internet, they've got access to everything, but it's access to the public information, not this private, discrete information.
Mm.
That community group is just been like a gold mine for and I think anybody who gets access to it with a rare disease, like, will tell you the same thing. We go into consultations and our clinicians say, like, what does the community say? Because there's only like 12 published documents on this and there's not much around this symptom. So what does the community say? more community information, but it's hidden behind this closed door. So what is at the heart and soul of what we're trying to do is create a sticky, useful app experience that encourages people to come in and then contribute to the app community. We want them to share, and then we can help use that information, synthesize it, de-identify it, all of the safe and compliant things you would do with this type of medical information. But if we can have a community section where people are sharing, we can process that information, train an LLM or train an AI model to then share it back in a more structured way. And I think we're pretty convinced that this is like the unique value proposition of the app. It hasn't really been done before. Not this, there's acknowledgement around the value of community and experiential data. But this approach of capturing it, synthesizing it, and reusing it in like a triangulation of community data, published literature, and also your patient records, there's nothing like it. So we are convinced that like we're onto a new idea, and now it's just about sort of executing on that as well. But yeah, what really sparked and led us to it, it was self-need and our own experience.
It's an interesting one, right? Because you almost take it for granted that you could go online and Google, basically Dr. Google, right? But there's also an interesting aspect just listening to you talk through that, which is the point of view of what you get is almost always from the doctor's point of view rather than the family or the actual people kind of going through the process of the disease, right? So I think there's almost a whole aspect of what's the other end of the story that's missing that people can share, that's part of the problem to solve for.
I'm just going to say, like, we've run into like multiple examples of where we've used that community information to help drive a better outcome for Felix. He had a NG tube, the nasal gastric tube, for feeding because he was unable to feed. That was causing a lot of irritation, vomiting, and the clinicians were sort of like, well, this is the process. Let's keep him on it and see how he goes over the next 12 months. This poor child was like having vomits like 12 times a day, every 2 hours, just being like irritated, vomiting. We looked at the community, understood from them that these feeding challenges are long-term. They're not just for infancy years. And a lot of them have these into later life. So the best course of action is to get the G tube, the button in the stomach. So we shared this back with our clinicians. There's nothing on like published literature around when a person should get this or not, because it's just not really studied. But when you go to these private Facebook community groups, there's 200 comments or 150 comments around, yes, you should get this because they're going to have long-term issues. And we've got multiple little examples like that help drive better outcomes. Our clinicians were said, yeah, okay, that makes sense. Let's get the G tube. His vomiting decreased. It then led to different pain. But again, we went back to the community. They looked at using different tubes, different taping ways to secure the tube, like all of this type of stuff that you just don't get from that medical perspective, like you mentioned, Kiet.
Yeah, because when I was doing research around this particular domain before this podcast, I noticed in Australian government actually published one of a paper. They're using a term called patient-led innovations for a lot of real disease, kind of because of there's so little information about from both researchers and doctor and hospital, they actually rely on what they call the patient-led innovation, which is exactly what you guys are doing here. Around they were hoping to doing collecting all these kind of detailed information, feeding all the way out to provide a bit better ecosystems as well. So well, I wonder if we actually it's the time, can we have a look at the app itself? Because we hear so much about it, and then I really, really wanted to see it.
Yeah, let's try and do a live demo. These are always fun.
Yes. And our audience will have a lot of emphasis around this process as well.
Yeah.
So very safe environment.
Yeah. I'm going to hit share. Now, can we see that?
Yes, we can.
That's step one. The sharing's also like the hard thing sometimes. So this is the home screen of the app. So this is installed. It's on my phone right now. It's not a Figma prototype. It's working software.
Amazing.
Currently running a pilot through Test Flight and the Google Store. We've got multiple families within Australia who are testing this at the moment, and we've also got multiple families from the US who are very interested in testing it. But we're starting small, and we're slowly working to the bigger picture. So yeah, as we sort of mentioned, the app has multiple features. There is the AI health companion at the top, which is that heart and soul around the AI, and then there's other features that we sort of think about, like the sticky factors that help people keep coming back to the app. So I'll just flick through them quickly. I won't spend too much, but yeah, I'll come back to the AI health companion here. So it's that chat GPT type experience. I will
Wow.
come back to it. We have our timeline here. So this is our app. So this is real information that we have for Felix. Within the timeline, you create different events. You can create personal notes and reminders through push notifications. You can pick up symptoms. So some of it's probably a bit confronting, but it's very real. Felix having multiple nosebleeds. He's got to go see an ENT specialist about this. We've got different medications in here. And the idea is that you try to journal, you capture your daily interactions with
Mm.
symptom and medication, appointments, test results, or notes. And then all of this information is being captured via a RAG process. It's been synthesized and then added to a RAG database that can be accessed for the AI agent as well. Um, we have our community section, which is very lightweight at the moment because we don't have a lot of members. Basically, this community group, which we sort of set it up like a Reddit system where you can join or you can not join groups as well. That process
Wow.
was informed based on some of the experiences of people through our user testing as well. So rare diseases, because I mentioned that it's so broad. And even the topics that people discuss in some of these forums are so broad. So you've got all of these different systems. Some might be relevant, some might not be. But even down to like the more casual things. So there's like chats. There's been topics that we've heard around like, should my child get a tattoo? Some people don't think that's relevant for a community or for certain discussions. We've got sections for memorials, so remembering people who potentially have passed or have passed. Again, some people have expressed in those community groups without filtering, they don't want to see that information. They don't want that. So we just tried this like, group type approach. But the intent is everything that is posted in here with consent, with proper consent principles and the ethics behind that, will then be synthesized, de-identified, synthesized, and added to a database, again, to have access for that LLM. We've got things set up like the account and profile and push notifications. We've got our document uploads, so you can upload PDF images that get processed as well. And then what happens if I say, tell me about Felix? So there's sort of three buckets of information. There's the patient records, which is everything in your timeline and any information that I've uploaded. There's then the community insights from anything discussed in that community. And there's the published literature. So we do have copies of the peer-reviewed medical literature, which is that clinical source of truth. So the agent will go through and do that sort of triangulation of what's relevant and give you out a response here. It's quite long because we've got a fair bit of information about Felix in here, but it's got his obviously profile information, his diagnosis. It's got his different diagnosis. It's got his current systems, so the most relevant, most recent ones from his timeline. What we do is we've got support workers that we upload their support notes in here as well. So it's got care notes, different complexities. So we can get a pretty good summary. We can also do things like from here, say, give me like tell me about all of his gastro issues for the past 30 days. And it will scan through the timeline events, pull out gastro or GI related issues within that time frame. So if I'm going to a gastro appointment, I can easily do this on the way there. I've got my couple of paragraphs as a summary, and then I can prepared. So it's really just about like empowering, helping me feel more in control, and be prepared.
And also the doctor, can you imagine if I'm the doctor at the moment where coming in, my patient actually give me all this information about this like patient instead of me going through try to piece every single information together. How good this is.
Yeah, because you do. It is very overwhelming when you go into these consults. Like the tell me about Felix. Like I don't know how many times I've had to. I get that, and it's like, well, where do I start? And you often have like this 5-10 minute consultation where you have to dump information, and it's super overwhelming to have to recall everything that's relevant. Otherwise, you do sort of miss your opportunity, and then you can sort of a missed consultation, or it's misinterpreted. So yeah, being prepared in a way that you can get what you need across is super important.
Yeah.
To your point, Charlotte, during our discovery process, we spoke to a few clinicians and researchers as well, and they were so excited to be able to see something like this, particularly in complex cases where it's not a straightforward answer. Um, you know, we spoke to Felix's cardiologist, and he was just so excited to be able to get a brief like this, walk into a conversation where he gets the relevant information so then he can quickly go into solutioning mode and finding the right care pathway for Felix and his best next step.
Wow. So that means this app is not only designed for one persona for the parents, it actually also designed personas for the clinicians as well.
Yeah, it will be in its MVP sort of state at the moment. It is mainly sort of the caregiver patient themselves for older people living with these conditions. As we've had conversations with some adults who live with Myhre. But yeah, we do think there's definitely like a clinician view that can help them get up to speed, whether it's on the patient individually or just the general sort of the syndrome. Being able to go in and have like a way to quickly get relevant information for them, like what are all the cardiology related things in Myhre syndrome. That's a key outcome that we want to help clinicians.
Thanks so much for sharing this app. This is amazing. Like I would say, this is actually one of the most smooth kind of product demo I have seen. It's like the apps looks really, really easy to use, and then it really, really like reflect about the pain point you were discussing at the beginning around consolidate all the information. I really, really like the whole journaling part of it as well, because I do know, well, I'm not a parent, but I have a lot of friends who are parents. I do know about how much information about raising a kids it is. Probably that's something Kiet and Jen, both of you can add a bit more. So just have one single places for you to be able to keep track around everything, and then pulling up in all the relevant conversation. This feature itself, I feel like it just will be so helpful to almost any parents. It's not only parents with real disease as well. It's just there's so much potential about this app.
Yeah, spot on. The first thing that came to mind when I was looking through it was we had a very similar journey for eczema for my kids, right? In that, I guess slightly different and nowhere near as life-threatening, but there's in the early days when they first developed, there's all this uncertainty, and you jump on Facebook groups and there's all these there's all these opinions, and it's hard to filter out what's actually an opinion versus kind of medically backed kind of or research backed science. And just being able to navigate through that would have been really, really handy. And, you know, we were just writing everything down on paper in terms of tracking their progress, or are they allergic to this, or are they sensitive to so that this would have been really helpful in that particular case. Another observation is, weirdly enough, going full circle, I actually designed the original Life's Little Treasures mobile app. They're a foundation for premature kids. So very, very similar, a lot of parallels in terms of use cases. Is all about documenting events and tracking it, being able to graph it over time and whatever it is. But I think it was more of a comment around the credit to Apple's design systems, because when I designed it, it was over a decade ago. a lot of the things are still very relevant. Obviously, the AI stuff is all brand new, but it's just interesting how a lot of the design patterns are still exactly the same, even though the interfaces are so much cleaner now. Well done.
Wow.
That's a huge task to kind of close out in months.
Yeah, it's amazing. And now have an actual user using them as well. Actually, that might be a good follow-up question to ask. How do you guys feel right now with all the apps coming out and then foundation moving out? It sounds like it is also getting a bit better throughout the process. How do you guys feel?
Do you want to share, Ines? How do you feel?
I feel super proud to be working on something that genuinely can improve the lives of people by using technology. And I think that is the purpose of technology, to make our lives easier, better, to get answers that we previously couldn't get answers to. I also am conflicted because I'm wondering why we haven't solved this space before. Because of that, I think it's just a motivating factor for me internally to continue to get the impact that we're looking to achieve.
Yeah, you feel like the next generation of parents were really grateful who asked that question to say, has this problem been solved? I'm so glad it's been solved by James and Ines.
From the people in the community we're chatting with and showing this, and they're like, yeah, this is going to help, which is yeah, very, very validating, very energizing, I would say. Going from this screen and then having somebody use it and getting that feedback is super energizing. And we know, I know that like the way it's built and some of the features are very light on, and it's that first version.
Mm.
And probably that last 10% of doing the bug fixes and getting authentication and doing our compliance and doing the security checks is not energizing at all. But as soon as we test flight approved, I could see the installs. I was like, okay, what are we doing next? Like, let's go. So yeah, definitely feeling energized with this pilot.
Oh, that's good to hear. And also, with the part of you were talking about the whole security check, authentications, that's definitely part of life of a tech founder, unfortunately. We have like 80% of the fun bits, and then we always have like 20% the boring stuff. I can't swear on this podcast, so I won't say it, but that part is always the part kind of drag us down as well.
So you both came from a product and design background respectively. How has that shaped your approach to creating the foundation, creating the app?
Yeah. So I think like, even though we are wearing many hats, I think we still sort of default to our normal hats. I'm a product designer, but I've been using AI tools to build this, Claude Code and B0 and the rest of it. But yeah, it's super powerful. But we often remind ourselves like, well, let's go back to our like first principles. So doing our proper pain point identification. So I mentioned that we were doing like, we were in a hospital ward ideating and working on this. We had a whiteboard in Felix's room. It was his daily medical notes for the doctors. And then next to it, we were like sketching like, what are our pain points here? Let's map out this user flow. The clinicians would come in and be like, what are you guys doing? And it's like, oh, I'm just mapping out this user journey of the app we're going to build. And we were using that with nurses and the clinicians as like, it was our user research. It was firsthand user research with people. So like understanding that it's like that contextual inquiry type research. You're in the moment. You are your user, but you're in the moment. But then even our process of like engaging with the community, we put up surveys within the Facebook group. We got contact details, and then we went on and did one-on-one discovery sessions. We mocked up prototypes using B0 because it's rapid like prototypes. And then put them in front of people for feedback as well. So we were all of the time creating like this repository of information, knowledge, gaining that evidence to help us sort of validate. And in product design, like that's what you would probably be doing. So yeah, that was giving us sort of enough confidence to move forward as well. So yeah, definitely leaning back onto that like user research, validate your hypothesis, rapidly prototype that first diamond. It was like first time, and we were doing that true and true.
That's amazing. Oh my God. Just imagine like doctors and nurses coming in and then starting to like looking at the whole journey, feel like they probably also feel like their needs being heard, their pain points kind of being validated at the same time as well. That's
Oof.
incredible.
Yeah.
Yeah.
Yeah. What about you, Ines?
Absolutely. I think some things were different, but a lot of our kind of processes defaulted to our product hats. And so I think in product, we talk a lot about empathy, but for us, that becomes really real really quickly when you're speaking to people at the coalface who are navigating a rare disease. So I think, we were really firm on our why as we worked through the what and the how. And I think fundamental product principles before you start anything. I would say where we kind of really needed to expand and grow the existing principles would be around having our experiences in large enterprise organization. Often think about the balance of governance and innovation. And so it's kind of like how quickly can we move to bring value to people who really need this, but how do we also do it in a way that is going to be almost at that enterprise grade? And I think, when we first started looking at this and solving this problem in a way that can scale, we started to apply for a few funding grants, and we were looking at all of the governance principles that existed on official websites. And we couldn't find answers around what are the trusted AI kind of principles that we can lean on in a specific sector, because what we were doing was really new in meeting this unmet need in a specific way. We'd spent I think a few nights just trying to work out what is the guidance that's coming down from the governance bodies that exist in this space, and it just wasn't there. And so we really had to put on our principles hat to say, well, how do we do this safely in a way that people can trust it, and in a way that they feel empowered with what they're doing with their data. So I think, kind of using those initial product principles, but then when you are working in uncertainty, how do you fall back on them to get the right outcomes for the people that you are solving something for?
It must be extra hard because exactly what you mentioned there, Ines. You guys are actually leading the whole wave there about the problem domain space and also regarding the use of AI and the whole technology space as well. That's why I feel like some sort of partnership with this organization become really important because basically you are creating some rules in the way as well. So that's so incredible.
Yeah. And the health industry itself is not the easiest to navigate when it comes to compliance in general, right? And then even if you're not using AI, you're not doing cutting edge, there's always this impression that to release any health-related product, there's at least a decade of compliance and regulatory hurdles you have to pass before you actually release it, right? So it's quite amazing what you guys have achieved.
Yeah, within the time frame.
Thanks, Kiet. As well, there is a shifting tide. Health information is one of the most personal things that we own. But I think when we think about the rare disease space in particular, these are people who fall outside of that typical safety net, and they need something different to catch them. And so whether that is their communities and the information that is shared from those communities, and that becomes their kind of hope and pathway to a better outcome, it really does shift data as a compliance piece versus data as a true insight toward a better outcome. And I think that's what we're hearing in a lot of the conversations that we're having as well in the community. But as well, more broadly on a systematic level, the tide is really shifting in terms of you being your own expert in your health, as well as then supporting clinicians and having the right conversation with your clinician, tapping into the newest research. And it's about how do we shorten that time of leveraging that research insight, empowering your clinician to have it, but as well using that community translational information to get the best outcome for that person.
You have been doing so many of the different experimenting, all this build. So what is that one proudest moment so far you kind of click to you to say, hey, we really got this?
The one proudest, I could easily say just getting it into the hands of people. But I think the proudest moment, and I continually have this proudest moment, is when we go into these consults and the clinicians will say well, what did the community say? like, because it is so validating. We had this at a appointment like 2 weeks ago, a week and a half ago up at Westmead. The first consult, there was a neurology appointment. He's one of like the world's leading neurologists for rare diseases, and we sat down for about 15 minutes, discussed Felix, and then he literally said, for word to word, what does the community say? And you just get like this wave of like, oh my God, we are solving an issue here and it's going to help people. He understands it. He didn't know we were building the app. No idea any of this is going on.
Wow.
But yeah, for me, like it's this continual proud moment that I know we are going in the right direction and we're going to solve something, and yeah, we've got this buzz. Now we just have to keep making it happen. Yeah, I mean there's probably plenty of proud moments in there. But for me that's like the one that just keeps popping up and just making me feel very, very, very energized.
That giving me a goosebump. What has been more better than your target customer talking about your problem domain word by word, exactly like what you said? That's like, that just give me like goosebumps when you say that example.
Yeah, it's almost the opposite end of the spectrum of rocking up to your doctor and saying, "Hey, I've got this bump on weird bump. I googled it, right?" And doctor's gonna be like, "Not this again, right?" But it's the opposite end of that spectrum, which is like, "Oh my God, there is nothing anywhere, no information," and you're just like handing it all over on a plate, and then getting that reinforced by kind of the world-leading experts is, I imagine, quite reinforcing in terms of the validation of what you're here to do. Was anything particularly surprising in terms of the journey so far that perhaps no one ever warned you about?
I think for me, when we had initially started this, it kind of grew organically, but it grew really quickly for us. So we kind of started thinking about, what are the problems we need to solve for ourselves in that environment. Then it kind of grew to how do we connect in with the Myhre syndrome community and help give them a better pathway in terms of navigating what they're experiencing. And then we kind of fell into the rare disease space more broadly. Whilst Myhre Syndrome Foundation really exists to serve that community, what we discovered is just how unmet all of the rare syndromes needs are. And so while they have a lot of unique differences, their experiences across kind of their journey has a lot of commonalities. So I think that really surprised me. And I think there's a few stats just around how big this problem is, but also how underserved it has been historically. And so often we talk about Alzheimer's being a really, really large problem to solve, diabetes, cancer, but rare disease collectively is bigger than all of these combined. It blows my mind, and it's so surprising how we haven't tapped into finding a better way to help people who do navigate a rare disease have better outcomes. So I think for me, that has been the most surprising aspect.
Why do you think that's the case? Is there any assumptions?
Yeah, we have dived a little bit into this, and interestingly, and maybe not interestingly, a lot of it has been, the hospitals at a systematic level has been set up in a certain way. At the moment, rare diseases lack the coding to actually put it in the system for a disease to be recognized. And I think there's about 96% of rare diseases are not even coded. So if we're unable to get the data to, show this problem, it kind of sits under the radar, and it's actually called the invisible healthcare crisis, because we just don't have historically the right data to be able to make informed decisions about how we navigate forward toward better outcomes.
That really makes sense, because things like data is the key there. When you don't have them, it's very hard to basically explain, the impact around that as well.
Yeah, and it's a broad systematic kind of issue that we're navigating in. And so for us, this is a really big problem space to tackle, but how do we almost create the quickest impact for the people who experience it, which was really that origin piece for Rare Journey. If we can empower the person with the right information, each individual person then collectively has a better experience, while there are systematic issues and data challenges continuing to be kind of tackled at that systematic level.
Yeah.
It's an interesting one because if I put the hat of a cold-hearted product person, right? Your typical
product person are not cold-hearted. We need to have a different analogy, a cold-hearted capitalism or something.
I stole it from one of my favorite podcasts about economists. Typically, your approach is, what are the economies of scale you can tackle, right? But listen, Ines, to your kind of description around the size of the problem, it's almost like there's a whole long tail that people are ignoring, right? And what are the real option is, what are the commonalities of people experiencing in that long tail, and how can you service and solve the biggest problems that they have, right? And literally no one in the world is doing that, right? So it's a huge opportunity.
Yeah, absolutely. And I think that the tide is definitely changing. To your point about economies of scale, I'm going to borrow an analogy that I'm taking from a leading genomicist. And he describes it as the hospital system kind of assumes that the patterns that people experience, they're kind of looking for horses. Whereas when you're thinking about rare disease, we actually find a zebra. And so how do you get this system to be thinking about the zebra at first? Because when we do that, what we see is, and we solve for one use case, there can be often beneficial outcomes. So the first COVID vaccine came out of a really small use case, but we know that it had global reach. And so there's a beautiful tragedy in if we can solve the complex problems that exist in rare disease, that economies of scale really open up because it has far more broad ranging opportunities to help more people.
Even just the whole app itself, like even it was talking about specified for mirroring, but I definitely, as we mentioned before, we feel like it's really applicable for all the other rare disease and potentially not rare disease, other disease as well. So that's why I feel like there's so much opportunity around these solutions. They start with something kind of very tangible. Yeah, I also see a lot of opportunity for scale as well.
Yeah, so when we started to dig into it, we found that, there's 7 to 10,000 rare diseases globally and about 300 million people that live with a rare disease. And that's going to be unreported as well. So it's just, it's baffling how we haven't solved this global issue, in a way that is A, specific to the person, but also B, can kind of hit that economies of scale, that commercial benefit, as well as the lived experiences of the people who navigate it.
Wow, that's amazing. I was just thinking about, we talk a lot about the founder journey so far. We talk about quite a lot of the proudest moment, pricing moment. And as Ines probably listened from most of the How I Build This podcast, there's always going to be around the toughest moments as well. Just like that's probably what every single founder's going through as well. So we will be interested to hear a little bit about what is that toughest moments that you guys have been experienced?
Yeah, I've had probably a few of them. Obviously, like working on a product in this space where it's very personal and sort of bound in grief as well is hard. It's going to be hard. We've had interview sessions with people going through similar experiences, and it's very hard to hear them talk about it. It's hard to listen. We were on the other day, and I was finding it so tough to treat it like a user research session because I had so much empathy and I just wanted to discuss her experiences just to help sort of be a ear to her. But I also had a mod guide that I needed to get through and get all of the information for our product development as well. So yeah, it is tough working in this space. The other issues is, so a product designer, not an engineer, but like self-teaching yourself how to utilize these AI tools, which do like supercharge you. They turn you into a superhuman in like productivity and being able to do all of this stuff. And I'm sure we've probably all experienced it where, I don't know, you use like B0, you build that front end, but then nothing behind it actually works.
This is my life in general, summarized about most of the AI tool I have ever built. So please tell us more about that. How did you conquer that?
It's this build trap mentality that Ines likes to call me out in having, and I shamelessly have it as well. But yeah, you get into this mindset. It's like, oh, I'm building this flow, I'm doing this thing, and it starts to sort of, it's semi-working. I had this feature, but there's a bug, and then you realize that bug, you have to change something else, and then you realize, well, that database scheme is completely wrong for where I want to be, so it needs to change. But there's another feature relying on that, and as somebody who hasn't properly architected a product like this, beyond sort of like the user flows and the interface and working with engineers and experienced people who do that sort of layer, yeah, you definitely run into these hicks, and I've had to scrap things, restart multiple times. But again, it's a learning experience, and it's nothing that you can't get through. We have sort of started to reflect and change our process. So instead of just like jumping in and being like, build me this feature, it's like, right, how does that actually impact? Where does that, what's the outcome? Like, go back to your product roots and plan it properly. We got Miro boards out where we're doing our data sort of diagrams and our flows before we jump into Claude Code.
Yeah.
Because you go very fast early, but then you have
Yeah.
to slow down to fix all of your errors. But there is this happy middle ground that if you go a little bit fast at the start and get a better rough idea, then overall you'll have a better outcome. So yeah, I think like using and upskilling in the way you use AI tools has definitely been a learning experience. I'm sure you've probably also seen like a lot of the stuff on TikTok and Instagram around like people generating PRDs or giving. Like that stuff's it's a bit scam. Like I don't know, I've not worked really in a team or organization that uses a PRD. I think the way products are actually built is completely different, but there's this whole mentality of, oh, you generate this one ChatGPT document that doesn't
Yeah.
really understand your users. It doesn't really highlight pain points. It has no real depth to solving the problem you're solving. And then you put that to AI and think it's going to solve all of your issues as well. Nah, I don't buy it. I definitely think there's, and we have been talking about this, like a product opportunity for not a PRD, but something that can help better build a plan to get
Yes.
you Claude Code or these AI tools. I stand by a PRD is not that solution, but I think there is a gap in the market for that. Like I think MCPs start to sort of help address it somehow. But yeah, another more product ideas, not enough time for us.
Yeah, no, that's a really inspiring. That's super, super resonate because at the moment I'm working in an environment that we have to get a lot of product out of door very quickly, and then we also have some very confident builder in the room. Sometimes we're feeling this build trap multiple times as well because it's quite easy with AI to get the 70% done, get people excited around some of this idea. But a lot of those idea really is prototype essentially in the way. When you really want to take that 70% to what we're expecting as the product, which is basically you have to do all the other back end of it, the all part we're talking about authentication, security. If you want to do it right, that 30% is actually almost require you rebuild the whole thing if you don't plan it carefully. So that is something very, very interesting. I feel like it's going to be very resonate with basically all the builder in the community as well. So if you are doing on that product, let me know. I would be part of your group around that. And it's not really an ask, but that's actually one of the reasons why early on when there's so many vibe coding tool out, there's a Lovable, there's a V0, there's a Vercel. The particular one during the time I like the most was the Google one. There's a Firebase Studio, I believe is what they call. Because they force you to go through the traditional product management 101. You have to thinking about a blueprint, thinking about your design, you're talking about the problem you're trying to solve. They force you to go through step by step before you actually start building. And even when you're building, they back and forth with you, which is during the time they didn't took off. I think it's because they probably for most people, they have most of the extra click. People don't like it. People wanted to just upload the generic PRD and they build. They don't have it. But that one during the time, I was like, this is actually one of one. They force some critical thinking for people behind it as well. But yeah, let's completely sidetrack because I just get like overexcited about this particular direction around it because how resonate that one it is.
I love that both the problem and the solution is AI, right? Because to what James said, before all these modern tools, to get to a stage where you have a publishable product would have been crazy in terms of the amount of time that you need to spend from a non-technical person. But now, because the tools are so well put together, but you still need to give them the context and the right guidance to create the code that's actually production ready, right? So with that learning, I'm curious to understand, one, what's next for the app itself, and then two, with what you've learned so far, what would you do differently?
Yeah, but do differently. I think like leaning into that app AI tools is like it's super relevant and super important, but it shouldn't replace your critical thinking. And I've run into circumstances where I have let it do that, and it has had some very funny reactions. I was first very much experimenting with like the custom GPTs, and I'm sure you've seen like these things
Yes.
on TikTok and Instagram. It's like you give it a set of instructions, and it's like act as a co-founder, be critical of my ideas, and not just supportive, and analyze this as if you've got a stake in the game. So I was like doing a lot of experimenting around this, and had a custom GPT set up. And it was like just agreeing with me. It just kept saying, do this. And I was like, oh man, I don't really like this, like where it's going, because I know I'm not going in the right place. So I went into the settings and I was like, can you please be like critical of this? Like act like you've got a stake in it, like is a financial and time investment. And all of a sudden it was like, the next response was like, James, stop what you're doing right now. Do not go ahead. And I was like, I said, oh, I'm only just ideating, like I'm just trying to brainstorm this. And it actually got very critical. It said, what's the term? It said, James, you're doing intellectual procrastination disguised as strategy. Stop right now, with like exclamation marks. And I was like, hang on, man, just like how easy. And it was one of those points that you realize it's only as good as like the instructions you give it, or the you put in. And
Mm.
it just like changing a couple of adjectives. I said, instead of being critical, be highly critical. And changing a couple of words like that completely changed what it was guiding me to do as a next. And it was just like one of those moments I was like, oh, maybe I just need to put the brake on ChatGPT and go back to Miro and do my own thinking here.
Mm. Mm.
Yeah, like I think they empower you, but you also do need to be wary of it. So that's probably one of the things that I would say, not do differently, but just to watch out for people relying heavily on these tools, because even down to like Claude Code building things, you don't know what it's doing. And it's so sure of it. These tools are so sure of themselves. They're like, yep, I'm doing this right. It's like, oh, well, can you double check your work? And then its response be like, oh, actually, I saw this. So those little ways of working with the AI tools, I think definitely watch out.
So what about what's going to be the next for the app?
Yeah, there's a few different things. We're continuing doing our discovery sessions with different users. We want to get in touch with the people who are piloting this, and as like any good product, hopefully we want to use that user feedback to sort of guide where we're headed. There's a few like fundamental things within the app that we know just aren't there as well, like image uploads. We upload PDFs, but we don't have image uploads. Everybody would probably be taking photos of their paper documents. So like small quality of life improvements that we've dodged, we need to go back and address those. And then there's probably this big compliance question mark as well, as Kiet was mentioning before, like medical compliance is a big thing. A lot of the tools that we're relying on do have a lot of compliance built in out of the box as well, which is good in terms around like data security and where's it's being stored. So yeah, we've got a few pretty solid steps in. Continue the pilot, and then fix up some of these things. Ines, do you have a thought on where we could go next?
We've got bold visions for our product roadmap, and it's big, it's hairy, it's audacious, but there is a real drive for us to build toward that, which is all around, how do we build this sticky app that really helps people while they're navigating something so challenging. And so being able to work toward that roadmap is something that is really exciting, but also how do we really validate that the outcomes that we're seeking to achieve for people are being met? So can we put around some objectives and key results? The first one is around validate the problem space. The next one is around validate desirability. So really then thinking about the next 3 to 5 objectives and key results that we can be working toward to continuously validate that we are on the right track. And I think that kind of speaks to how we want to be working, which is that continuous testing and validation, continuing to be anchored in the outcomes for our users.
I can hear the whole kind of a product thinking essentially being embedded throughout the whole process. Really love that. I know this whole app, it is about solving a particular patient problems. But again, if this question is not relevant, we can skip it. But I do want to talk a little bit about funding and money as well in general. So how did you actually approach that, like a funding? Is that kind of something in your mind at the moment?
Yeah, it is in our mind. It has been not neglected, but not solved. So we are we're pretty confident in our desire to have it as a mission-led product, and we want to keep it free for users. So people going through these experiences, I would really love it if they didn't have to cop another subscription cost on top of everything else they're dealing with. In order to do that, there will need to be like a pretty robust commercialization strategy behind it, which we don't have solved yet. We've got ideas. We're thinking about like partnerships with rare disease foundations. There are sort of like peak bodies as well that could support it, research bodies. But no, we haven't really nailed that side of things yet. To date, everything has been bootstrapped. It's just our time on weekends, on evenings, on mornings. Software development costs is really like subscription costs is really the bulk of the cost at the moment. We have sourced, and there are these available and it might be a good sort of founder tip. There are a lot of startup programs out there. So there's Google offers them, like Microsoft, and they give you credits or discounts to partnered programs. So you can get like Microsoft Azure credits. So we can do like all our free AI token testing. You get discounts for like Miro for collaboration and productivity tools and things like that. So yeah, those types of things I think are very great to explore if you're bootstrapping as a first time founder. Once we get a little bit more mature through this pilot, and probably once we hit the public release, we do want to sort of look at a better strategy, whether it's VC funding or other funding approaches. But for now, it's a bit more like, let's continue to prove the value and build out this concept. But we're probably closer than we think. I'm sure there's been businesses out there that have been funded with much less developed.
Yeah.
So it is a step that we do want to take as well. One thing we have talked about is there's a big trend in like building in public. Self-promotion is not really something I like to do. I'm not really a big social media guy, but I do see a lot of these companies and startups doing this build in public just to lift their profile, get out there. It's something, we haven't done. We've talked about it. We have to find the right angle of doing it, but it's also something we want to explore, again, just to market the idea, market ourselves and what we're trying to do.
So for people who are listening, all the audience or product pals, people who has connections in the, I guess, health industries, public government industry, or VC funder who is in the position who can connect the group with whatever organization it is, this is kind of a call to actions. Please stay in touch because it's such a good product. I'm sure there will be some sort of right kind of organizations wanting to be partnered with, wanting to take forward. I guess it's really just about finding the right connection to get into it, essentially.
Yeah. I guess if I play forward and all goes well, particularly you tap the right market in terms of, let's say, medical advertising, and you've got the money's coming through, you're getting the right feedback from customers, and you get it to a pressure point where, this is beyond what you can do outside of your day job. What does scaling this look like?
Yeah. I guess like our goal is to scale it. Like we're not building this just as a prototype or a hobby. Like we are passionate that there is a big problem to solve here, and that's what we want to do. So what that scale looks like is, from our product background, would be looking to build out your core product team. I would stop being a pseudo engineer, and we'd probably bring on proper engineering talent is where like our immediate next step. Between Ines and myself, we probably do fill out like the core of that product team very well. So dedicated engineering talent to help guide us build in the right direction. is probably the first next step. The way the app's set up as well is we've sort of set it up as based on a patient profile, and that patient would set a condition or primary diagnosis. In our case, we've started with Myhre because it's the one close to us. The next sort of scale to that is onboarding additional rare diseases as well. Again, we have a few ideas of where we could potentially go through some of the foundation work that Ines and Ivana, my wife, has been doing. Through some of our chats, we have been in touch with some other foundations from rare diseases, so we could potentially look at onboarding those. And so yeah, how we scale, basically securing our core team, which really the gap is engineering, and then probably marketing. I think like, yes, there's the product development, but also business development. And I think marketing in itself is probably undersold, more underappreciated in there. So there's potentially a marketing or business development side. And then in terms of the product scale, obviously we want to pump out and improve our core feature set, but also onboarding new rare diseases.
I do have some idea about what could this marketing could look like. Maybe we can have a separate chat around that because there's a few ideas when you're just talking through. Actually, I think that might actually be suitable as well. However, good times definitely like flies because we have been chatting for literally like an hour and a half as well. So we probably wanted to ask the last questions of the day. There's so many like other product powers people who are listening. They are thinking about starting a business themselves. What would be your advice for them?
I think for me, it might sound cliche, but you really need to care about the problem space that you're looking to solve. When your motivation dips or you've got 100 things on your plate and one thing needs to drop, I think having that kind of connection into the problem that you want to solve is going to be the thing that continues you through. We're all going to get advice when we're starting our careers to find what we're passionate about. And that takes time, that takes personal kind of experiences. And I would just say, think about your own personal story, where you kind of naturally find yourself spending time. And think about what are the unmet needs in that space and how you can improve things that already are, existing on that market.
This is such a good example, and this app is such a good example about that. I feel like it's a good connection about personal journey to the actually a concrete kind of a problem to solve for a community as well. So it's just so inspiring. What about you, James? Do you have any wisdom you want to pass down?
Yeah, I think just having like and I struggled with this a lot, is like having the bravery just to make a start and do something and commit. Was a lot of those ideas I sort of mentioned earlier, like they were like the 20%, that first 20%, but I never sort of had that bravery to take it to the next step and start to get it public. And I even took me, I don't know, up until the last few weeks to make our first LinkedIn post for Rare Journey. I had the butterflies in the tummy. I was very nervous. I'm like, oh, we're putting it out there. This podcast is like something, we're putting it out there.
Yeah.
And it's taken a lot of like failed attempts to get to that point. So I think there is like an element of, doesn't matter what other people think, you believe in it and you get it out there. Getting it out there is a big step. And back on to what Ines said, I think caring about it, caring about what you're doing is important. Whether it's deeply emotionally a connection or just something you're passionate about and can enjoy. I have one like sort of last little story, and it was when I was spitballing with ChatGPT or Claude. It was another side hustle idea. And its words of wisdom, which I found very fun, was, is this something you think or you can see yourself doing for the next 2 years? Like 8 hours a day for the next 2 years, because that's what it's going to realistically take. And your answer is no, I don't think I can sit here. I was going to do like UX reviews for apps or something like that. And it was like, do I really want to review apps for 8 hours a day, every day for the next 2 years? And my answer was no. And I think like that was very, very telling. So that's not my advice. That's like AI's advice. But I think it's a nice what framing it like, are you interested enough in this topic, or is it just something you saw a sponsored ad on and caught your attention and now you want to run with it? So yeah, ask yourself that question, and then if it is, get it out there. I think the barrier for entry for like creating software and solutions has never been lower.
Mm.
So have a crack, get it out there, and then see where it goes.
Yeah, I think that's such a good point, James. So I recently just came back from South by Southwest, and um, you know, a lot of the hype was around AI, and it lowering the barrier to entry around technical capability. And so there's a lot of thinking around, well, if the technical barrier is so low, what is going to be the differentiator? Um,
Mm.
and I think it is an interesting equation to play around with, having product kind of expertise and skill sets. The differentiator, I think, becomes almost taste in what you want to solve, and how you solve it. But then secondly, probably to this audience is your will to solve it. And so I think if you have those two parts of the equation, that technical side is just becoming easier and easier over time. So lean into those first two to work towards something, that has you excited.
Yeah, 100%. But I feel like the other things what Jim said was also really resonate around is the courage and brave. And then because I feel like everyone have those kind of idea, everyone have some sort of things they're passionate about, but really taking the risk to almost full in, because there's always opportunity cost for what we're doing here, because all the 48 hours that when we're using to do the hackathon and building the product, you can using that to spending time with a family or doing something else. So taking the whole courage to say commit to it, to say this is something that I wanted to spending my time to invest on it, it's a very big step. So congratulations to taking that steps as well. This is actually massive.
Yes.
Mm.
James and Ines, thank you. Thank you for sharing your story with us and the story of little Felix as well. It was incredible hearing the story behind Myhre Syndrome, the Foundation Australia and Rare Journey. If our audiences wanted to kind of find out a little bit more about Rare Journey and the Myhre Syndrome Foundation Australia, how do they find you?
Yeah, so we have a website live. It's therarejourney.com. On there is a bit of a snapshot of the app. There is a demo video, which again is a bit of a story about Felix and our journey. We are taking subscriptions for newsletters on there, and we want to start that as like a regular comms channel. We are also looking at a Kickstarter program. So we'll, keep some details up, and maybe once this podcast goes out, we can provide some details on there. It'll probably be on the website as well. Again, that's just one of the ideas that we have around sort of funding this initial product to help us get it to where we want to be. But that's probably the best ways at the moment.
Thank you very much. I think this is the end of the episode. Thank you all.
Bye.
Thanks,
you guys.
Charlotte.
It's been great.